This is Crossroads Magazine, telling the good news stories of people in our neighborhoods and communities. Charting courses of virtue and value through the wilderness challenges of day-to-day life. Finding the good way in the everyday crossroads of life and walking that way.
Good morning and welcome to Crossroads Magazine. I'm Father John Gatsack. Thanks for joining us. On this week's program, we'll find out more about a recent warning from the U.S. Surgeon General. And there's a very unique summer camp in Norwalk that teaches young people an ancient tradition. We'll find out more about that in just a few. Plus, an exhibit at the Knights of Columbus Museum highlights an amazing work of art. First up, nearly 5 million people are treated for skin cancer every year in the United States. That's an astounding number, and one that should get the attention of all of us. It got the U.S. Surgeon General's attention and prompted him to issue a call to action. Crossroads reporter Stephanie Balikas brings us the story.
The incidence of skin cancer is so high that the number of new cases of skin cancer each year is greater than the number of breast, colon, prostate, and lung cancer combined. That's huge.
So huge, in fact, that the Surgeon General recently issued a call to action to prevent skin cancer, calling it a major public health problem that requires immediate action.
It's really a call to action for the community to provide shade for schools, for community spaces, and any outdoor play areas for kids. You know, really making the community accountable for it as well, that it's not just mom and dad. These schools have to think about shade structures.
Dr. Jennifer Pennoyer is at the forefront of the latest advances in the field of dermatology.
From 1973 to 2011, melanoma rates have increased 200%. So we've known it's been on the rise. We talk a lot about sun protection and sunscreen, but there really is that common belief that a little tan is a good thing and that you've got to get some sun to get your vitamin D. So I think there's a lot of misconceptions out there.
Among the common misconceptions, the fact that tanned skin is a sign of health, that only light-skinned people get skin cancer, and that you're safe behind the tinted glass of your car.
I generally do twice as many skin cancers on the left side from driving. We spend our lives in our cars, driving to and from work and doing errands. You're getting ultraviolet through that tinted window that you have. It's not perfect.
Dr. Pennoyer says that sun damage is cumulative and begins in childhood.
So with every ultraviolet exposure, we do have little damages to our DNA. Our immune system is very good at picking up on the majority of those and repairing it. But it can't repair all of it.
The good news, though, is that skin cancer, if found early, can be treated.
So the most common skin cancer is basal cell carcinoma, entirely due to that person's sun exposure. Too much sun, and you'll get a basal cell. There's no genetics to that, but is incredibly common. The second most common is squamous cell carcinoma, which the majority of those are slow growing, but there does occur a more aggressive variant that can go to lymph nodes and cause death. So you need to be careful with that as well. Entirely due to too much sun. No genetics on that one either. Melanoma is the least common, but the most dangerous of all. And those arise from a mole. About 12% of the time there is a genetic component to that. There has been a linking with melanoma genetically with pancreatic cancer in some families. But for the most part, that's due to too much sun as well.
Dr. Pennoyer says that it's important to know what's on your body. She recommends examining yourself at least once a month. An easy way to look for the warning signs is to follow the ABCDEs.
A is for asymmetry, so any skin lesion should be symmetric, meaning one side matches the other. Nobody makes moles perfectly round or perfectly oval, but they should essentially match. Clear borders are important. When something is growing or changing, you frequently have a foggy or fuzzy border on one side. C is for color. Blue and black, we don't really like the appearance of those. Sometimes red, if there's an area where it's growing, it's red at that active border. D is for diameter, anything bigger than a pencil eraser. Some people say, watch out for, although never say never, they can always be smaller. E is for evolving. If there's an evolving or changing lesion, you want to take notice of it.
So, awareness, knowing what to look for and actually looking, and preventative measures, sunscreen and shade, are key to avoiding and combating skin cancer. In Bloomfield, reporting for Crossroads Magazine, I'm Stephanie Velikas.
Among the new developments to come out of the Surgeon General's call to action, the Food and Drug Administration will have to rule on new sunscreens in a shorter amount of time, opening up the market to better products. Also, tanning beds and sun lamps will be required to have FDA warning labels.